Knee pain when bending is a very common problem, but what causes it? And when should you be worried? Many people notice knee pain when they squat, kneel, climb stairs, or stand up from a chair. Today's video, I'm going to go over the 7 causes of knee pain when bending, one of them which needs immediate medical attention. Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician. The knee is one of the most complex joints in the body. It contains bones, cartilage, ligament, tendons, and fluid-filled sacs that help everything move smoothly. Because so many structures are involved, pain when bending the knee can come from several different causes. Bending the knee places pressure on several parts of the joint at once. The kneecap presses against the thigh bone. The cartilage absorbs the force, and the ligaments and tendons stabilize the movement. If any of these structures become irritated, inflamed, or damaged, bending the knee can trigger pain. Activities that repeatedly load a bent knee, such as squatting, climbing stairs, running, or lifting for long periods often make the pain worse. The exact cause often depends on a person's age, activity level, and whether there was a recent injury. The first potential cause of knee pain when bending is something called Patellofemoral pain syndrome. Patellofemoral pain syndrome is a condition that especially is common in active people under the age of 40 and affects roughly 1/4 of the population at some point in their lives. It can definitely cause knee pain when bending the knee. The pain usually develops slowly and is felt in the front of the knee, around the kneecap. Many people notice discomfort when climbing stairs, squatting, or sitting with their knees bent for a long period of time. This is why it's sometimes called the movie theater knee. Patellofemoral pain occurs when the kneecap does not glide smoothly along the groove of the thigh bone. Muscle imbalances, especially weakness in the quadriceps or hip muscles, can cause the kneecap to track incorrectly and move over time. Over time, this abnormal movement places extra stress on the joint and produces pain during bending. The second major cause of knee pain during bending is a meniscus tear. The meniscus is a piece of cartilage that acts like a shock absorber between the thigh bone and the shin bone. Meniscus tears affect 12% of adults. In younger people, they often happen during sports or sudden twisting injuries. A person may feel a sharp pain after pivoting, squatting, or landing awkwardly. In adults over 40, meniscus tears are often degenerative. This means the cartilage slowly weakens over time and can tear with normal movements. Pain is usually felt along the side of the knee where the tear has occurred. Some people also notice catching, locking, or some swelling, and sometimes they can feel locking that creates an ability that they can't fully bend or straighten their leg. Third major cause of knee pain when bending, especially in adults over 45, is osteoarthritis. Osteoarthritis happens when the cartilage that cushions the joint gradually wears down. As the cartilage thins, the bones begin to rub against each other, leading to stiffness and pain. People with knee osteoarthritis often feel discomfort during activity that place weight on the joint, such as walking downhill, climbing stairs, or getting up from a seated position. Bending the knee increases pressure inside the joint, which can make the pain worse. Morning stiffness is common in knee osteoarthritis, but it usually improves with about 30 minutes after moving around. A fourth cause of pain when bending the knee can also come from the patellar tendon, which connects the kneecap to the shin bone. This condition is known as patellar tendinopathy, or jumper's knee. It is especially common in athletes participating in jumping sports such as basketball, volleyball, or track. The pain is usually felt directly below the kneecap. It becomes worse during activities that involve jumping, running, or squatting. Pressing on the tendon often causes tenderness, and the pain may increase when straighten the knee against resistance. Over time, repeated stress on the tendon can cause it to thicken and become irritated. Bursitis around the knee can also cause knee pain when bending, which is the 5th potential cause. The knee also contains several small fluid sacs called bursa. These sacs reduce friction between bones, tendons, and skin. When a bursa becomes inflamed, the condition is called bursitis. 2 common types are prepatellar bursitis and Pezin-Serine bursitis. Prepatellar bursitis occurs in the front of the knee and is often caused by repeated kneeling. It can lead to swelling and tenderness over the front of the knee, making bending uncomfortable. Pezin-Serine bursitis occurs on the inner side of the knee where several tendons attach to the shin bone. The pain is usually felt slightly below the knee joint and becomes worse when bending or climbing stairs. A 6th potential cause of knee pain when bending is anterior cruciate ligament, an ACL tear. An injury usually occurs during a sport or sudden trauma and often causes the knees to swell rapidly. Many people describe a popping sensation followed by instability or the feeling that the knee may give way. A 7th potential cause that is very uncommon but serious is something called septic arthritis. While most cases of knee pain during bending are related to overuse or degenerative disease, some causes require urgent medical attention. This is one of them. Because it is a serious infection inside the joint, this condition causes severe pain with any movement. swelling, warmth, and often fever. Because infections can quickly damage the joint, they require immediate medical treatment. There are some signs and symptoms that should make you seek medical care quickly. Knee pain when bending often improves with rest, physical therapy, and strengthening exercise. However, if you are having severe pain, inability to bear weight, significant swelling, fever, or a knee that locks or feels unstable, you should go and see your doctor as soon as possible. Because the knee is such an important joint for daily movement, even small problems can cause noticeable discomfort. Identifying the underlying cause is the key to finding the right treatment and returning to pain-free movement. What questions do you have about your joints? Drop them in the comments below, and I'll do my best to answer them in the future video. Remember to hit like and subscribe, and I'll see you in the next one.